So I think we've already talked about the problems with modern medical research. I think nutritional science is even more challenging because the quality of the data and reliability is probably even more of an issue. But at the same time, the public health crisis we have, that we're facing, is that we have this global epidemic of obesity. In the UK, we're now the fattest nation in Europe. More than 60% of the adult population are now overweight or obese. 60%. And 1 in 3 children, by the time they leave primary school, by the time of 11 years old, are also overweight or obese. So we've clearly done something very, very wrong. This is a real world, indisputable data that we have this problem. Now, the cost of obesity is very high, but actually more important is the associated diseases of obesity. And type 2 diabetes in the National Health Service in the UK is now the single most common, it has a single biggest cost on the healthcare system. About 10% of the cost of healthcare in the UK goes into the management of type 2 diabetes. It's costing the UK economy and the National Health Service around £20 billion a year. Projections suggest it will hit 40 billion pounds a year by 2035 unless action is taken. And so far we don't seem to have done anything to curb this epidemic. World Health Organization announced the global problem of obesity as a public health issue or crisis in 2004. So we are 14 years on, and we've not really got any evidence from any places of significant reductions in the prevalence. The trends are getting worse. So we've got to understand why that's happened. Now, clearly it's diet. Clearly. It's the most important. In fact, within the diet issue, the root cause, where there is a good consensus of opinion, is that the food environment, the obesogenic food environment, is probably the most important factor. It's become impossible to avoid cheap, sugary, processed foods wherever you go, whether it's in the gas station, whether it's in gyms. I mean, the high street, obviously, even health clubs. But for me, and one of the places where my journey started, the biggest scandal, I say this is really a scandal, is that we even allowed our hospitals to become a branding opportunity for the junk food industry. I mean, it is extraordinary. I mean, you laugh, but it's extraordinary. We allowed our hospitals to be a branding opportunity for the junk food industry. One hospital I worked in London, as you know, if you have a heart attack, you have to be bedbound for 24 hours. There were contracts in the hospital that ensured that specific products had to be delivered to the patient who's bedbound, such as sugary drinks, Coca-Cola, potato chips or crisps, and candy. This is compulsory in the contract in the hospital. So it's no surprise also when you look at the staff. So I looked around me. We have this public health crisis, and then if you look at the staff in the hospital, the statistics now, 50% of NHS employees, doctors, nurses, non-clinical staff are also overweight or obese. So either the education is wrong, which probably is, but more importantly, it tells you that education is also ineffective if the food environment is working against you. Most of our behavior with food is because of environmental reasons. It's not personal responsibility. So again, another one of my crusades or missions is having operated on a guy in the middle of the night who had a heart attack and then was being served junk food the next morning on the ward round. When I was talking to him about healthy diet, I then went on a campaign to try and improve hospital food or get junk food out of hospitals, because I thought with this crisis that's going on, we as a profession should at the very least set the right example. Why are our hospitals actually perpetuating this problem? So I lobbied the British Medical Association, BMA. I wrote a piece in the BMJ in 2013 again, on the day that I was asked to go and deliver a speech to pass a motion. The British Medical Association, they had an annual conference, and I gave a speech to say it should be part of the policy of all doctors, the doctors' body, the British Medical Association, the Union of Doctors, to say, yes, we as a group say, get junk food out of hospitals, ban junk food being sold in hospitals. And it got an overwhelming majority, it made a Guardian News as well, that doctors call for this. So that was good, and I presented evidence for this. About actually how selling junk food in hospitals influences even behavior of people visiting hospitals. So a study of pediatric institutions in the United States revealed that people who went to a hospital that sold junk food were 4 times more likely to purchase junk food when they left the hospital than people who never visited the hospital in the first place. So actually, subconsciously, the hospital is legitimizing junk food. It's not important what you eat. I mean, it's nonsense, but that's really what people are thinking. The profession, the medical profession. I didn't learn anything in medical school about the impact of nutrition on chronic disease or health. So the profession, we're not empowered and trained. There's a lack of knowledge. There's an ignorance. So all these things combine, and we've allowed this situation to happen. And then very recently, just to give you a bit of a story, things take time to change. The hospital where I grew up, the local hospital, became the first hospital in the country to ban the sale of sugary drinks and sugary foods. In fact, they offer low-carb options now in the canteen. And this has started a kind of, hopefully the beginning of a revolution. So all hospitals in the UK will do the same. And right now, globally, poor diet contributes to more disease and death than physical inactivity, smoking, and alcohol combined. Poor diet is the major issue with chronic disease. The evidence is strong. Now, we talk about, earlier it was mentioned, I think one of the cardiologists mentioned about the impacts of different things on health and longevity. This is Tom Friedman's health impact pyramid. And what it tells you is making the default choice. Socioeconomic factors clearly are most important, interestingly, when it comes to health. But the largest impact on health is making the context the healthy choice, the easy choice. So we know that's happened whether it's taking trans fats out of foods, smoke-free buildings, taxing tobacco. You know, these have had the biggest impact on population health. Education, minimal. Telling people to eat healthy and being active. On a population level, pretty useless. Actually pretty useless. If your food environment is bad, if you've got smoking environment, telling people will have a very minimal effect when it comes to population. So you need something that's going to hit all parts of the population. And that means, for example, the big issue at the moment, I'm not talking in a lot of detail today, but sugar is a big problem, the overconsumption of sugar. Now, if we agree that junk food is a problem, and I think most people would agree, even Lewis, I think, would agree, overconsumption of ultra-processed junk food, nutritionally poor, calorie-dense foods is not good. Okay, it's probably the major issue. Forget about the debate about nutritional science, whether it's fat or saturated fat. We'll come on to that. But if we acknowledge that ultra-processed food consumption is a problem, then this is really quite shocking. There was a study done, I think the researcher was actually Brazilian on this particular study, where they looked at the association of ultra-processed food consumption and obesity in many different countries. And the UK was one of the worst. And we have obviously, you've seen already the statistics on obesity there. Half of the UK adult, half of the British diet now, half is ultra-processed food. That's extraordinary, isn't it? Interestingly, in Europe, Portugal actually had the best. They had the least consumption of ultra-processed food and the least obesity. So they eat more traditionally. They eat more, you know, cook at home, etc. So half of the diet is ultra-processed food here. And then breaking it down, so this is a separate study in the BMJ that linked ultra-processed food consumption to cancer. And the association was interesting about this, and I'm going to argue this point as well. This is beyond calories. So the association of ultra-processed food and cancer was independent of body mass index. And I'm going to explain why there's no such thing as a healthy weight. It's complete nonsense, unscientific nonsense. But this breaks down the components of ultra-processed food, and it's not fat. Public health policy so far has said, let's get your fat consumption down. Okay, this eating fat makes you fat. It sounds coherent, but it's actually not true when you look at it. So if you look at the ultra-processed food, most of it is actually coming from sugar, sugary drinks, starch, ultra-processed fruit and vegetables. So 77% of this ultra-processed food consumption is coming from starch and sugar. So many people in the scientific community now are respected saying public health policy should be focusing on reducing starch and sugar, not fat. And the fat's contribution is very, very small. So Robert Lustig is a pediatrician in America. He was the first guy in many years to come out and say, publishing in Nature said that sugar is a major issue. It needs to be regulated like alcohol and tobacco because it fulfills criteria that deserve its regulation. It's toxic when consumed in excess. It's become unavoidable. More than 70% of foods in the supermarket have added sugar in them. it has a potential for abuse, and it has a negative impact on society. And this is really where, me as a cardiologist, why am I interested in this? Well, I look at the data for most people now being admitted with myocardial infarction, heart attack today. Most of them have the metabolic syndrome. And the metabolic syndrome is any three of increased triglycerides, low HDL cholesterol, increased waist circumference, and hypertension, and pre-diabetes or diabetes. Have you noticed neither LDL cholesterol or BMI is in that? Yes, 66% of the patients admitted with heart attack have metabolic syndrome, and there is science and evidence to suggest that consumption of sugar in excess promotes insulin resistance. This syndrome, the metabolic syndrome, is also synonymous with insulin resistance syndrome. The concept essentially of your body becoming resistant to the hormone insulin over time by consuming, either you can be very overweight, or through a process, actually it starts before you become overweight. And it's predominantly driven by processed carbohydrates and sugar consumption. That seems to be the driving factor. Alcohol in excess probably also. So this just is a slightly crude slide, but just to emphasize the concept to you that up to 40% of people with a normal body mass index have markers of the metabolic syndrome. So there is no such thing as a healthy weight. There's only a healthy person. Now, you can have a very unhealthy weight. You can be morbidly obese, etc. But there's no such thing as a healthy weight. Why am I saying this? Is that we're all vulnerable. And the data on sugar certainly seems to suggest that the impact, again, of sugar on health is independent of calories. So I wrote an editorial in 2015 in the British Journal of Sports Medicine, which has been very widely publicized and had an altimetric score of 3,400. And it's exactly, we had the same backlash, because the same thing that Lewis said. It was called, it's time to bust the myth of physical inactivity and obesity. You cannot outrun a bad diet, okay? Because the food industry, for their obvious reasons, had pushed this message, junk food industry, it's all about exercise. So they can sell you more junk food. They even associate it with sport. But one of the citations we used was a very interesting study from Stanford. It's an econometric analysis study. They looked at food availability across 175 countries across the world to see what predicted in the food availability in the environment that was consumed, what predicted type 2 diabetes increase in the population. And what they found was for every 150 excess calories of sugar, typical of a can of Coke, compared to 150 calories of protein or fat, there was an 11-fold increase in the prevalence of type 2 diabetes. But the more interesting finding was it was independent of BMI and independent of exercise. So in other words, the concept suggests that even if you're slim and you do lots of exercise, if you're consuming too much sugar, you're increasing your risk of type 2 diabetes. More recently, so this was published last year, just to re-emphasize the point, a lot of public health advice, I would argue, the most important root cause behind our obesity epidemic is this wrong focus, misguided focus, that it's all about lowering saturated fat consumption to lower cholesterol, and this has been the priority. And the indirect effect is that actually what we've done is we've promoted an industry of low-fat foods, we've consumed more sugar, we've consumed more refined carbohydrates. There's good data to suggest we've been doing that, and this has driven up type 2 diabetes and obesity, because type 2 diabetes is a condition of carbohydrate intolerance. People get better when they cut the carbohydrates if they've got type 2. Their glucose control gets better. So we wrote this article last year, myself. Rita Redberg is the editor of JAMA, Internal Medicine. She's a cardiologist. Pascal Meyer is also a cardiologist and the editor of Open Heart. And we decided in the title to make it very, very clear, dietary saturated fat does not cause heart disease. Systematic reviews for healthy people and systematic reviews of RCTs, randomized controlled trials for people with heart disease, show lowering saturated fat has no benefit. And there may be a suggestion of actual benefit in reducing stroke risk, but again, these are associations. But what we can say at the very least, there is no good evidence to suggest it causes heart disease. But what does cause heart disease? What is a more plausible change in the narrative of what is underlying the cause of heart disease, and then what can we do about it? And this is a slide we put together to actually show that the real factors behind heart disease are a combination of insulin resistance and chronic and systemic inflammation. Now, what's interesting is insulin resistance and systemic inflammation is also responsible for about 50 to 70% of hypertension, at least associated with it. Is it causal? We don't know for sure, but it's definitely associated. Type 2 diabetes, it's a precursor for type 2. And when you look at mathematical modeling studies on different risk factors, for certainly young men, insulin resistance is the #1 risk factor for heart attack. So you put that all together, you come up with this model. The question is, what's the best approach? Is it through drug treatment in the overall insulin resistance and inflammation? No, it doesn't seem to be. It's actually lifestyle, simple lifestyle changes. So I call it a high-fat Mediterranean diet. Again, looking at all the evidence that's available to us suggests a Mediterranean diet which is low in sugar and refined carbohydrates is probably the healthiest diet in terms of the evidence we have. Certainly low in sugar. Other things you can do, regular activity. So, you know, just walking 30 minutes a day, 5 days a week for cardiovascular disease prevention is probably the best thing you can do. You don't need to join a gym, brisk walking. Maybe that too much exercise also increases cardiovascular risk because of stress on the body. Stress reduction, meditation, yoga, very effective. There's good data that it has an effect on all these systemic inflammation and insulin resistance. And of course, smoking cessation, which is now reduced dramatically in Western countries, but is still a problem in developing countries. So this is really the change in the paradigm that we need to concentrate on insulin resistance and systemic inflammation. Interestingly, this was the most read, widely publicized article in all BMJ journals last year, 70 journals. So it was the most read article, which actually in some ways has some interesting observations that might help guide us for the future for our health, but is actually the place where the American scientist who said saturated fat raises cholesterol and causes heart disease spent about 6 months of the year for 30 years of his life living in this village where they have an average life expectancy still of close to 90, more than 10 years more than the average Tour de France cyclist, and they do no prescribed exercise, there's no gyms, okay? There are many people live over the age of 100, and they age well. They have a healthy lifespan. They've not got chronic disease. So the question is, what is the secrets of this village? So I went there as an observation. I made a documentary film called The Big Fat Fix with my co-producer, Donal O'Neill, who's a former international athlete and filmmaker. And we wanted to look at the village. How do these people live? What are the secrets? And how do we marry these observations of the village with the up-to-date medical research on what constitutes a healthy lifestyle? And we produced this book called The Piopi Diet, and a few myths that we busted in it was basically saying that the Mediterranean diet has been wrongly interpreted because, again, to some degree industry influence, but essentially they suggested that we should have 6 to 11 portions, the food pyramid, from starchy carbohydrates, which is really a metabolic disaster. It has proven to be. Eating fat, providing you cut the refined carbohydrates. I had a discussion with Lewis on a video yesterday about this. For us, certainly, it seems to be more effective at controlling weight. So providing you cut the refined carbs and processed food, eating fat will not make you fat, and there's lots of reasons to explain that. Cholesterol can be good for you. Listen, it's one of the most vital molecules in the body. Without cholesterol, we would die. You know, the body synthesizes cholesterol for a reason. And a systematic review that I wrote in 2016 with a number of other authors, we looked at LDL cholesterol over 60, and we found no association with heart disease. No association with heart disease if you're over 60, if your LDL is high, and an inverse association with all-cause mortality. Now, the explanation we gave for this is that one of the functions of cholesterol is involved in the immune system, and elderly people are particularly prone to dying from infections such as pneumonia. We don't know if it's the right explanation, but it's a plausible one. So I remember a patient came to see me who was in her early 60s, and she was very scared. She walked into the consultation room, and she was almost white. And she said, she came to see me in the clinic, and she says, my general practitioner has said my cholesterol is high. I'm really worried. And I said, congratulations. You're probably going to live longer. And I explained her this, and she walked out happy. I had a choosing wisely conversation with her. I felt I did my job that day. Lewis may disagree, but anyway. And you can't err on a bad diet. But I think most important, what I've learned as a doctor of almost 17 years, as a cardiologist, you know, good health, what it means to be healthy, good health rarely comes out of a medicine bottle. Okay? Good health is about all the other things that we have forgotten. It's about eating well. It's about social relationships. It's about getting a good sleep. Maybe meditation. You know, these are really the components, I believe, are truly components of what it means to be healthy and what good health. So, and with dietary changes, the effects, certainly my observations and good data shows the effects on health markers are very rapid, similar to medications, but they come without side effects. So this is just an anecdote of somebody I've never met. This is a guy called Stephen Ty, who's happy for me to share this with you. He's in his early 60s, and he'd read my work, followed my articles. A lot of people that write to me like this, and he said he was diagnosed with type 2 diabetes and hypertension for many years, and he was angry, to be honest. Why have I got all these conditions? He read some of my work and somebody called Jason Fung, and he says that I've totally reversed my metabolic syndrome. He did this within months. His HbA1c is normal, his blood pressure has normalized, and his fatty liver is getting better, and he's very happy. He's happy. He's done this. He's come off his medications. He's changed his lifestyle. So this stuff works. Certainly it's worked for him. And it certainly worked in the short term. Maybe we haven't got the long-term data to say, but an immediate effect is he's come off his medications from doing this, cutting out the sugar and the refined carbohydrates. Now, what other data do we have? There are two organizations independent of industry, one in the UK called diabetes.co.uk and Virta Health in America, and they're showing some really extraordinary results just from nothing intensive. Diabetes.co.uk have got about 285,000 members now. They don't take any money from the drug industry, and they give an advice on diet, just advice for people with type 2 diabetes on their program. And they're seeing very amazing, really good results within a year, 71% engagement in a year, about 1,000 people signed up there. 40% of the patients eliminate at least one of their type 2 diabetes medications. HbA1c controls a little bit better. 60% of people are able to eliminate insulin. That's huge. That's a big number of people coming off insulin just from changing diet. No exercise, intensive exercise. It's just dietary changes from advice. So not actually very expensive. And then you've got Virta Health in the United States who are also showing similar, and also interestingly, the metabolic markers get better. Triglycerides, HDL improve as well from this low carbohydrate approach. So listen, perhaps regretfully, the pioneering heart transplant surgeon Christian Barnard said towards the end of his career, I've saved the lives of 150 people from heart transplants. If I concentrated on preventative medicine earlier, I could have saved 150 million. In my view, lifestyle is that medicine. Thank you.